I'm going to do a short vaccine series because I'm tired of people suggesting that COVID vaccines are causing symptoms that are caused by COVID. This review paper is looking at patients that were given COVID vaccines that have a history of neurologic disorders, so they already have neurologic conditions, with a history of Guillain-Barré syndrome, chronic inflammatory demyelinating polyneuropathy, and multifocal motor neuropathy. Spoiler, the COVID vaccine in patients with immune-mediated neuropathies seems to be safe. So why is this an important study? Well, they're looking at patients with immune-mediated neuropathies, and there's often a concern with these patients about the safety of the vaccinations because of a possible reoccurrence or exacerbation of the diseases they already have. So they're directly looking at the question if COVID vaccines can safely be administered to these patients. 3 medical centers participated in the study. So again, they're starting with patients that have these neurologic symptoms before the COVID pandemic, and they're taking a medical history baseline, and then they're giving the vaccine, which is time point 1. They're looking at 48 hours after the first vaccination, 48 hours after the second vaccination, and then 6 weeks after that second vaccination. How are these patients faring? Where they're specifically looking at if there is any self-reported deterioration in disease-related complaints. Of 177 patients with CIPD, only one of them reported worsening symptoms, and this seems to be a result of changing their maintenance treatment, not because of the vaccine. For GBS, there's only one of 162 patients that had a recurrence of their symptoms. However, after critically reviewing the medical records of that patient, the symptoms and signs were due to a lumbar spinal stenosis for which the patient underwent decompressive surgery. So again, not because of the vaccine. And finally, 10 out of 188 patients reported a worsening disease-related symptoms after the COVID vaccine, such as weakness and or sensory disturbances. But of these patients, 5 out of 10 did not report an alteration in their treatment regimen. So 5 did have an alteration in treatment regimen, which can be attributed to this. And then of the remaining 5, it fit within their normal ebb and flow of their history of symptoms. Only one of these 10, it can't be attributed to that because in the other 4, these symptoms normalized over time. So there is a no to low risk of COVID vaccination hurting people that already have neurologic symptoms, neurologic diseases. So if it's not occurring in this really vulnerable population, then we're probably not going to be concerned about the rest of the population as well.